Hi, you likely joined the webinar today to get insight and answers on whether to open an AFC of your own. Whether your motivation is a passion to care for those who can't live independently, to uplift the level of care that's being provided, maybe you're looking for a stable business opportunity, you're tired of working for someone else, or maybe you already own a facility and desire to open another. By the time we are done, you will have direction on which way to go and how to go about the process quicker than if you were to do it on your own. And if any of these scenarios I mentioned apply to you, today we are going to address common questions so you can decide for yourself whether to open a licensed AFC home in Michigan or not, and the first steps to take. So, as we start this discussion of whether or not to open a licensed AFC, I'd like you to picture yourself stranded on an island in a boat. Imagine yourself as Robinson Crusoe, trying to figure out how to survive and make up your strategy as you go. Well, that's how I felt in 2010 when I was invited to start opening up adult foster care homes. I transitioned from engineering and sales to open homes in West Michigan, aiming to provide that quality of care that you might want to do as well for adults and seniors. I found the learning curve was steep, and without the reliable systems or a supportive community, it often felt like being stranded on that island. Well, maybe you've had a similar experience in a classroom where a class didn't make sense without support, or maybe you've been lost in a city without a guide. It can sometimes feel overwhelming and even scary. Well, over time, we develop consistent processes to reduce confusion, improve employee retention, and provide outstanding care. And we also won awards as Best Provider and Employee of the Year for 3 consecutive years as we added homes. It was because of that anxiety and stress of figuring out those things on our own that Care Provider Solutions was formed. Our goal is to give individuals trusted and experienced support specialized to Michigan to open and operate successful homes. So, as a starting point, let's talk about what is a licensed AFC because there is some confusion as to what that actually means and what is the definition. First of all, some people refer to it as a group home, adult foster care home, residential assisted living, RAL, assisted living. All of these terms refer to a supported living environment, and sometimes these homes can be in a residential neighborhood. But ultimately, the the services being provided inside are all the same. What the definition of an AFC is, it's a facility where care services are provided 24 hours per day, 7 days a week for 3 to 20 adults and or seniors with limitations like traumatic brain injury, intellectual disabilities, mental illness, Alzheimer's, or other conditions. Staff helps with daily needs such as medication management, personal care, supervision, and providing enriching activities. Staff is allowed to sleep if it's not required by a special contract, but they must be on site at all times and readily available to take care of a resident's needs. What an AFC is not is an SUD. That stands for a substance abuse disorder facility. It also is not a facility that takes care of individuals under the age of 18. So let's talk about why you would want to license. First of all, based on a National Investment Center for Housing and Senior Care, there are 600,000 new care units needed by 2030. For individuals with developmental disabilities and mental illness, community and mental health agencies report consistently there is a great need for AFC homes, especially who specialize in individuals with behaviors or for individuals who are bound in a wheelchair. The income on average is from about $3,000 to $8,000 per month per resident for one not requiring one-on-one care. In specialized cases where there's extreme medical or behavioral or even memory care requirements where one-on-one staff is needed, we've worked with some groups that receive up to $36,000 per month per resident. Now, where do these funds come from? It really depends on your focus. Some of the most common ones are long-term care insurance, private pay, waiver, community and mental health, Michigan Department of Health and Human Services, or aid and attendance through VA. Now, what is another reason to license now that we know that? Well, the perception that is if someone goes through the steps to get licensed, that they're a more professional and reputable organization than one that has not. And of course, if the services you're providing meet the definition of when a license is required, then you would need to get one as well. So sometimes I get asked, what if I have an unlicensed facility and I'm providing care and I'm meeting that definition you reviewed? That's a really good question. What your next step would be to start the licensing process, be upfront with the state about your conversion from unlicensed to licensed, and then go through the process to be legitimate before the state comes to find you to demand that you change your status. What are we looking at as far as a time frame to get licensed? On the average, from our experience, it's anywhere from 2 months to 6 months from the time you submit your application. You cannot submit that application until you have a property secured to start that process. How do you do it in that time frame? Well, the key is to block off time on your calendar to get things done consistently. And that does assume that you have a responsive state consultant, of which our organization has no control over, and you have a mentor like Care Provider Solutions that can guide you quickly through the steps to get licensed as quickly as possible. Can you work a job at the same time as you're going through the licensing process? Absolutely. In fact, everyone that we've worked with is balancing working a job and licensing their facility at the same time. Now, I think it's important that you know that once you get your license, if your specialty is to take care of those with the mental illnesses and developmental disabilities, there will be a separate process to get contracted with the community and mental health services in your county and or surrounding counties, which will need to be taken into consideration as you create your budget and determine your startup costs. For facilities over 6 people, you must also add time for zoning approval, architectural drawing approval, and Bureau of Fire approval. Startup costs. What is that? So the most common upgrades a home would need would be non-lock against egress doorknobs, handrails, hardwired smoke detectors, which will be changing in the next year to wireless, furnace room door, home furnishings, amongst other things. You can expect to pay about $20,000 to $25,000 in renovations to get it ready for licensing, and that would include mentorship costs. Now, if you do plan to do major renovations like add wheelchair ramps or modify a bathroom for wheelchair accessibility, those startup costs could be much more. And in addition, if your capacity will be 7 people or more, you'll also have to budget for zoning approval, sealed architectural plans, a smoke alarm with a panel, and sprinkler installation. The state is also going to want to see 2 to 3 months of funds to cover your overhead expenses to cover the time while you're starting your income flow. So what does that mean? If your budget projects $15,000 of overhead expenses to run the business, including payroll and what you're going to pay yourself, the state would want to see $30,000 to $45,000 proof of funds in cash, an equity line of credit, assets that can be sold, and or income through other sources such as a job or private investors. Now, potentially that just kind of gave you a gut punch and you're like, well, I don't have that money. What do I do? Save is an old-fashioned way of doing it. Finding investors is another. Rent versus buy a property. Search out an SBA loan or a home equity line of credit. Maybe you like that term of investors. Where do you find those? Well, some have family and friends or outside organizations. Small Business Development Center is a great resource. They offer free business consulting and can help create a business plan and explore some of these resources to find that money. You can go to michigansbdc.org to set up that appointment. As far as funding support, usa.gov/start-business is also a great resource to find funding support if you need that help. So what are your first steps? I'm going to highlight a few right now, and then in a few slides, you will have a QR code with a more detailed list to determine if opening an AFC is right for you. First is finding that home. How do you go about doing that? Landlords to rent, real estate agents to buy. In either of these cases, our organization can help with scripts, resources to work with, individuals to work with, and whether or not the home is a good option based on licensing requirements and location. Some people like a turnkey operation, so rather than starting from scratch, they'll work with a broker that's looking to sell an existing AFC operation that's turnkey. It has employees, residents, and an income stream. That's another option to get started as well. What type of home is ideal? A ranch is ideal because it can accommodate any type of person with any limitation. If you need to use a two-story home, then bedrooms on the first floor with the bathroom and second level bedrooms is the next best option. Do you have a high school diploma? Do you have a year experience serving the population you desire on your license? Is your background check clear? And can a doctor provide a medical clearance and TB test for you? If any of those qualifications do not apply to you, you can appoint a person to function as the licensee and administrator who does. The next step is filling out your application. Now, the application is for a general AFC. For facilities who desire to specialize in providing care for the mentally ill and developmentally disabled, a specialized application is needed as well. With a specialized home, you have the ability to contract with community and mental health agencies who serve and would place individuals with developmental disabilities or mental illness in your facility. The application can be submitted online or filled in and sent through the mail. It's about $150 for that small group home application. Now, just remember, you can't complete that application without having that property first that you intend to run the business from. The next step is completing all your policies and procedures. If you're opening a small group home, the state requires a lot of documents before they'll even come to the home to inspect it. Can you take a guess as to what that might look like? Well, it's 29 of them. And because our organization specializes in mentorship and consulting to Michigan providers, we walk alongside you through the whole process, and we'll provide you templates and coaching to customize them for your own use. We make it easy for you. One of those policies is an admission policy. You can scan the QR code on the screen if you'd like to access it. This is an example of how we would help, of one that we would help you modify as part of our three-step startup process to get you licensed. In addition, as part of our startup program, you would receive templates for all the other policies and procedures, such as a budget, program statement, emergency policies and procedures, personnel policy, to name a few. We would provide assistance to customize them to your facility and populations you will serve. Upon submission of those policies and procedures to the state and your fingerprinting validating a clear background, the last step is an inspection of the home, and we would support you in that step as well. Now, before we give you the additional QR codes we promised, you may wonder, who is Care Provider Solutions and what do we do to support client success? Well, what we know for sure is that winging it doesn't work, but systems certainly do. We know how hard it is to work a job, start a business, and still run a household. And it can be overwhelming, and sometimes you might even want to cry. So, what we do is teach AFC owners what simple systems to put in place so that they can run their business better with less stress and ultimately can provide better resident care. And that includes starting up new licensed adult foster care facilities, along with courses, a membership, and a conference for AFC operators. Our team helps operators save wasted time figuring all the stuff out on their own using the experience we gained over 15 years of combination of owning our own homes and consulting. I also serve on the AFC Licensing Council, and our organization is a member of the Community Mental Health Association of Michigan to make sure that you're getting the most up-to-date information. Now, before we finish up, it's also important that you know what other people who have worked with our organization feel about this three-step process and what was their experience in working with Care Provider Solutions. We have many, many testimonials, but here are some of the words that others have said. If you've entered a new market or never opened an AFC in Michigan, you don't know anything. Nadine is knowledgeable and has a great deal of contacts and resources to guide you every step of the way to license as quickly as possible and meet all the Michigan regulations. With Care Provider Solutions, not only was our first inspection for licensing without citations, but the consultant asked her to pass on compliments to the consultant that helped her because the home was absolutely perfect. And that is consistently what happens when we work with providers. Another said, "Thank you, Care Provider Solutions, for all your help with my AFC home. You provided me a solid roadmap to help me succeed." So what happens next? We have 3 easy steps for you to follow. The first is to join our free community. So as you're considering the potential of licensing a home of your own, by joining this community, you will receive weekly tips, topics, and strategies that will help you learn what it takes to run a successful home. If you use GPS, this kind of functions as your GPS update, where it provides the rerouting to keep you on track, things like policy changes, things to make your job easier, and even encouragement. You also get access to free resources, contacts, and downloads. As I mentioned earlier, you would have additional insight on first steps to take before opening a new home. Scan this QR code for that information. So this is kind of like planning for a journey. Before you put the destination in that GPS system, you take initial steps to plan. These are your first steps that will give you the insight to get to your destination of getting your license on your journey. Now, once you enter the destination into GPS, we all know that sometimes it's going to take you on a course, takes you way out in the middle of nowhere or in a different direction, and it's going to require you to find that person that's lived in the area forever and knows the easiest way to get to where you're going, or drive around and waste a lot of time and try to figure it out on your own to get on the right track. Our organization is that trusted navigator. If after learning what you did today, you are ready to move forward, scan this QR code and take the free assessment. It will help us learn where you're at, set an action plan, and get you to your goal the quickest. And this also applies to existing AFC operators who are considering opening another facility and want the accountability to move through the process quickly. Once you answer the questions, you'll be prompted to set up an appointment with me to discuss the next steps to get you started. There is no fee to this initial consultation. We do have groups that start on a monthly basis, so contact us to find out when that next startup date is. And if you have any questions or answers, feel free to contact us and we'd be glad to guide you on your way. We look forward to the potential of working with you.